Well, good morning. Good morning. Dr. Yonnette here, back with you for another one of our sessions. I know you're becoming a pro at this. Baby AJ, baby Dominic, baby Mary, baby Alice is getting better and better at sleeping, and you are getting better at taking care of him or her, and you are feeling like a pro. Well, I am so happy for you. Now, today we are going to talk a little bit about fine motor skills. We talked before about gross motor skills, babies' development in general. And so we want to talk about the movements that your baby, would become involved in terms of using the hands, the upper extremity or the arms, and fine motor skills. When I talk about fine motor skills, I am talking about the way your baby is grasping onto things. A lot of babies hold on to your fingers and it's hard to get it out. That's reflex, but we're still looking at how the baby is grasping objects with their hands. We're also looking at vision, and mostly at visual motor skills, the eye-hand coordination piece. Visual motor skills, you have to have them to be able to coordinate the hands, the legs, and the rest of the body. So the difference between fine motor and gross motor, though, is that with gross motor skills, we are looking at the large muscles of the body, and with fine motor, we're looking at the smaller muscles. And babies need lots and lots of time, playtime, so that they can practice these fine motor skills. Now, let's look at your baby 0 to 3 months old. What are some of the things that you can expect from your baby? The baby should be able to bring his or her hands to its mouth. The baby should be able to move the arms and swing the arms at toys. You know, you have a dangling, the mobile that you have over the crib or the bassinet. The baby should be able to swing the arms towards those toys. And then the hands, look for the hands to start to open more. Instead of being fisted, you're looking for your baby to start to open his or her hands more. So fine motor skills are what we are talking about today. How are you doing, Mom? How are you doing, Dad? How is your baby growing and developing? Fine motor wise and gross motor wise. We talked about gross motor and how you should begin to see the arms and the legs kicking and moving around. You should be able to see your baby moving his or her head when he is lying down on his back or when he is lying on his tummy. And we said that lots and lots of tummy time is important to develop those gross motor muscles, those bigger muscles, those large muscles. So you want to make sure you're giving the baby tummy time. And today, our discussion is on fine motor, using those smaller muscles of the hands to help the child with eye-hand coordination. So now you know why you have those toys and things dangling above your baby's crib. Get a couple of them, put them over there with music and nice colors, so that the baby can begin to reach and try to use his or her hands. Lots and lots of time to play. Encourage your baby to open up the hands, and so that he is not fisted or she is not fisted all the time, but help your baby to begin to open up his or her hands so that he can participate in his environment. This is Dr. Yonnette, coming to you this morning talking a little bit about fine motor muscles. And I want to encourage you to be intentional with your child. Participate in the development, the motor development that you are seeing happening, or the developmental milestone that your child is going through, and be excited. Be excited as you see those milestones are being met. And if they're not being met, be vigilant. Look out, be careful, see what you're noticing. And if you're not noticing what should be taking place, make sure you speak with your pediatrician so that you can get the help you need to help your baby develop. I want you to share with me what you have been noticing with your baby. Send pictures, short videos, and share on this website, on my Facebook page. Also, go ahead and send a request to join my page. It's Skincare Explosion with Dr. Yonnette, and I would love to have you be a part of our discussion. This is Dr. Yonnette. It's Friday, yay! Happy Friday, and I'll see you again tomorrow.